Welcome to Urology Unplugged to all our viewers. Today we have our renowned guest, Dr. Samarth Agarwal, who is a renowned urologist from Siliguri, and we are here to discuss BPH, which is also known as prostate enlargement. So, doctor, thank you for giving us your time. We would like to know what is BPH, sir.
Thank you for inviting me. Okay, so today we have discussion on BPH. So as the name suggests, BPH is Benign Prostatic Hyperplasia. So in layman's term, it refers to prostatic enlargement, which is non-cancerous. Okay, so the prostate can enlarge by two processes. One is a normal age-related process, which occurs because of the hormonal changes in the body with aging. And the second enlargement might be due to malignancy. When the same prostate has malignant cells inside it, it can enlarge. So there are two types of enlargement. One is a benign enlargement that is totally normal, non-cancerous, and one is a cancerous enlargement.
So what are the common symptoms for BPH?
See, first of all, you have to understand where is prostate located, okay? So prostate is a very small organ, almost the size of walnut, and it is located in between your urinary bladder and the urethra. So it normally weighs around 20 to 22 grams. As a person ages, it tends to increase in size. So the role of prostate in the human body is during the reproductive years, which is in your 20s and 30s. So what prostate does is it causes production of semen, okay, which is required for fertility. But once your family planning is complete, your family life is complete, prostate becomes a vestigial organ in the body. It has no more purpose. The only problem with prostate is as the person increases in age, the prostate tends to enlarge in size. Okay. This occurs because of hormonal changes in the body. And because it is located between urinary bladder and urethra, as it increases in size, it causes obstruction to the flow of urine. Okay? So most of the symptoms are related to your urinary flow. So patients come with difficulty in voiding. The stream of urine is very slow. There is hesitancy, that is the start of micturition, that occurs after a few seconds. Okay? In most of cases, there is dribbling of urine. Okay? टप टप करके पेशाब गिरता है. स्पीड से नहीं होता, धार में नहीं आती है पेशाब. They have to frequently pass urine during the day, especially during the night also, thrice or 4 times. Okay? Some of them can even have blood in the urine. Now this occurs especially in malignant cases of prostate enlargement. Okay? So these are the common symptoms that patient
who are more likely to get BPH?
See, BPH tends to have genetic inheritance. So if your fathers and forefathers had prostatic enlargement, you are also going to have that.
Is it like 100% or is it like there are some less chances?
Yes, so in those who have genetic predisposition, 80 to 90% people will definitely have prostate enlargement. If you talk worldwide figures, without genetic inheritance also, around 70% of people above 70 years of age will have prostatic enlargement. So this is one disease which will catch you during your old age and make you suffer. So you cannot escape from it.
So suppose if someone has this genetic thing and he is aware of it,
yes,
what are the precautions we can take?
Yes, so those with genetic predisposition, they have to start screening early. So like normally prostate occurs after 60s and 70s and 80s, 6th, 7th and 8th decade of life. Those with genetic predisposition have to start screening from their 4th and 5th decade of life. So you have to start screening early. So in screening, there are a couple of tests that we do, especially like ultrasound or blood markers for prostate cancer, which you have to undergo yearly at least twice, starting your 50s. A normal person who do not have genetic predisposition, they can start off late after 6th or 7th decade of life. Okay.
So you spoke about the tests, sir.
Yes.
So like, what are the treatments that are available?
Yeah. See, a lot of wonderful treatments have now come up for prostate. So initially there are two broad categories of treatment. One is medical management, one is surgical management. So every patient, we first start with medical therapy.
Okay.
Currently, we have wonderful group of drugs like alpha blockers and anticholinergics. All these drugs are so specific that they act only on the prostate. So they have minimal side effect also. And it is for this reason patient takes this medical therapy for a number of years. Okay, 5 years, 10 years, 15 years, and they're very happy and satisfied. But then there are other cohort of patients in whom the medical therapy does not work. Okay, and in those patients we offer surgical treatment. The surgical treatment currently is all laser based. Okay, so such advanced lasers we have now, bipolar lasers and holmium lasers and thulium lasers, that the patient stays in the hospital only for 24 to 48 hours after surgery, and after that we are able to discharge the patient. There are no stitches involved, no cuts involved. The operation is totally painless, and also with minimum blood loss.
That's a relief.
Yes. So a lot of people are scared because, especially prostate is a disease of old age. So a lot of people in 70s and 80s come and say to us, sir, we did not have any operation throughout our life, and now you're suggesting us with an operation. So it is kind of traumatic for them mentally. But then they should be rest assured that such good therapies have now come up, that 99.99% the operation is complication free, risk free, and they don't have to worry much about it.
Sir, could you also let us know, like, how does it affect a man's life? Does it affect at all, or if it affects, how much does it affect? Like,
see, of course, there is. You're talking about the sexual part or the quality of life. It does definitely affect. For example, if a man has to wake up 4 to 5 times in the night, you can very well imagine how impaired the sleep cycle will be. Okay, he gets up and he won't be that fresh, and always there will be some irritability, sense of dizziness and all that. Okay.
And sir, post treatment, does it all recover?
Yeah, see, the post treatment, 90 to 95% patients have absolutely no problem. Some patients, 4 to 5% will have some problem, but that is more or less related to the lasers and technological advancement. That is not related to the surgeons, the way a surgeon is operating. It is more or less because of the instrumentation that the surgeon uses. But that is only 4 to 5%. So out of 10, 9 patients who get operated will have complete relief, and this is a one-time operation. Prostate, once operated, does not relapse. To relapse further, a person has to live again 30-40 years. Okay, so if he is living that long, we might
Have to
again operate him and clean him up. Yes. So overall, see, the treatments have become wonderful, and patient having prostate need not worry. We, even in tier 2 cities nowadays, we have wonderful treatments, and patients do not have to go to bigger cities for good treatment. We are very well doing a lot of prostate operations monthly. Okay.
And sir, like, I think our viewers will also enjoy to know a few of the myths that are there regarding BPH and prostate enlargement.
Few of the myths, see this, I can all say this from practical experience only, which patients have come and shared me. Firstly, you see, even at 70s and 80s and 90s of age, the surgery is totally risk-free. Okay, we have patients, we have operated 92-year patient for prostate, and he was so happy that after discharge he said, "Doctor, I will live for another 90 years now."
Oh wow!
He was so happy with the surgery. The surgeries are so nicely done because they are on laser based. There are no cuts involved. Okay, hardly we keep one day in the hospital. Okay, so need not worry. See, if you don't treat prostate, the problem lies there, because there are a lot of complications associated with keeping the prostate in the body. I'll name a few, like kidney failure. You don't pass urine, the kidney goes into back pressure mode, and whatever kidneys form in the urine goes from the urine that is formed in the kidney again goes back into the kidney, okay, spoiling your kidneys. You keep the prostate for long, there are chances of prostate cancer. You keep the prostate for long, there are chances of recurrent UTIs, okay, recurrent infections. You keep the prostate for long, there are risk of stone formation in the urinary bladder, okay. So rather than having all those complications, it is better you go for surgery, which is a one-time operation, hardly 20-25 minute operation, and you can also be all this complication and risk-free.
Okay. I think, sir, we have covered majority of the things, and I think our viewers got to know a lot. So that was all from Dr. Samarth Agarwal, and thank you, doctor, for your time. And viewers, I think you all have got a lot of information on BPH, which is also known as prostate enlargement. Thank you from Urology Unplugged. Thank you.
Thank you so much for having me. Thank you.